Many patients know that the side effects from chemotherapy are, frankly, awful. But luckily, there have been huge advancements in identifying who can safely skip chemotherapy, particularly those with estrogen receptor positive breast cancer. But what about other types of breast cancer? Let's hear from Dr. Wolff, who is involved in some of this research. Dr. Wolff, what is on the horizon for patients with HER2 positive breast cancer?
We now, with HER2 positive disease, we are slowly and surely reducing the amount of chemotherapy that patients need to get. And so when trials of HER2 positive disease and the approval of the drug trastuzumab, that is commercially known as Herceptin, became available around 2005 for patients with early stage disease, at that moment, we were giving antibody therapy, trastuzumab, against the HER2 receptor with 3 chemotherapy drugs. And then we realized we didn't need 3 chemotherapy drugs. We could get away with 2 chemotherapy drugs only. And now we have a situation that for patients with stage 1 HER2 positive disease, which means patients who have a tumor that is no greater than 2 centimeters, so 2 centimeters or less, and don't have involvement of lymph nodes in the axilla. What these patients need is a little bit of chemotherapy alone, and they often receive a drug called paclitaxel in combination with the antibody trastuzumab. And what we are learning today is that after 10 years of follow-up, the vast majority of patients, approaching 98% of patients, are alive without issues. And that is a dramatic improvement in what we have done and achieved so far.
So it sounds like less is more has really been optimal for this group of patients. So that is really promising news for those with HER2 positive disease. But Dr. Stover, how about those with triple negative breast cancer? We know that chemotherapy remains the standard of care for TNBC, but is there any hope for chemo optimization for these patients?
Historically, as Dr. Wolff mentioned, we would typically treat aggressive triple negative breast cancers with 3 chemotherapy drugs, one of which tends to be part of a class of drugs called anthracyclines. And anthracyclines have historically been a great advance for breast cancer treatment and have likely cured many women, but they come with some long-term potential side effects, including potential impact on the heart and on the bone marrow later on after receiving treatment. And as we have gone forward, similar to HER2 positive breast cancer, the question has raised, are there alternatives, or do all patients truly need all 3 chemotherapy agents and/or chemotherapy agents like anthracyclines, which may have some side effects we would like to avoid? And there have been several efforts to look at regimens that do not include anthracyclines and try to identify those patients who can get away with less to right-size them. One of those that is sort of at the cutting edge is the NeoPact trial, which includes a taxane chemotherapy, a platinum chemotherapy, carboplatin, and immunotherapy, or treatment to activate the body's immune system to help fight the cancer. And these are building on several trials over the last decade that have looked at this combination of these taxanes and carboplatin as the backbone of the chemotherapy. So 2 chemotherapy agents, neither of which is an anthracycline, to potentially get outstanding results. And we know from earlier studies, the WGS ADAPT and an earlier trial by the same group that's doing NeoPact, that taxane and carboplatin have very good response rates in triple negative breast cancers. So I think that we are still trying to identify which patients can avoid the anthracyclines. But I think the other approach that we're starting to take is letting the treatment tell us who those patients are. So starting with sort of a more backed off component of the therapy, seeing how they respond with surgery. And then if we need to do additional therapy after surgery, then we can tailor the optimal treatment for those patients.
This is all really great news for patients, especially in getting away from the concept of one size fits all. Everybody knows that's not true, and it's definitely not true in treatment as well. This is terrific news that this optimization could be available to even more patients soon.